Hey, good morning, everybody. This is Carl Steinlage. Happy to come back and do another Medicare 101 for Brand Asset Management Group. Any questions anybody has, please hold them till the end. You can use the chat function to ask them, and I will be happy to answer any questions and hang around for a little bit at the end. If anybody has a situation specific to their family or a loved one that they would like kind of more detailed, specific advice on, feel free to reach out. My contact info will be at the end, and we'll be happy to kind of coach you through whatever that may be. So my name is Carl Steinlage. I've had the luxury and privilege of partnering with Brand for a number of years, and my agency here in Lake St. Louis focuses on health insurance. So we have a full agency supporting clients who are kind of leaving the group-sponsored health world for the very first time. So whether that is kind of looking at COBRA, kids turning 26, wondering if their retiree plan is better than Obamacare, the exchange, bridging that gap between retirement and Medicare, and then enrolling into Medicare education, and then the selection of the most cost-effective Medicare solution. If anybody listening to this is turning 65 in the next couple of months, you'll start to notice this really heavy marketing push in your mailbox and on Facebook and on the phone, where it kind of gets a little bit tricky to navigate on your own for the first time. So we do offer guidance on selecting the most appropriate plan. And then once you're in Medicare, there's a window which we're in now called the annual enrollment period, where you can change your current selection if it no longer meets your needs. And so that Medicare annual enrollment period we'll talk about a little bit as well. And then finally, as we'll learn, the price you pay for Medicare is means tested. And so there's kind of a nasty acronym called IRMA that applies to certain situations, and there's an appeal process. So that is something we can help people with as well. So jumping right in, what is Medicare? So Medicare is the federal government's health insurance program. So as we're working from 18 until whenever, we are paying into the Medicare program through a payroll deduction. So we pay taxes into the Medicare program, and Medicare becomes available to you most frequently when you turn 65. So aging into Medicare at age 65, it becomes available to you the first day of the month you turn 65. And Medicare has two base components called Part A and Part B. So Part A is free for most people and covers hospitalization. Part B is a monthly premium. And late last week, we finally found out what the Medicare Part B premium is going to be for next year. In 2023, that Medicare premium was $164.90. And we're seeing a $10 jump for next year to $174.70. So let's call it $175 a month. That's called your standard Part B premium. And so if you enroll into Medicare A and B, you get a red, white, and blue Medicare card that looks like this. And that benefit covers approximately 80% of a hospital claim, a medical service, etc. And so we're kind of replacing our group-sponsored health insurance, which covers doctors and prescriptions and physical therapy and hospital stays, with this government-sponsored program. And so a lot of the confusion comes in with respect to what parts of Medicare do I need? There are certain penalties associated with not setting this up properly. And so a service or a very appreciated guidance that our agency can help you with is to figure out which one of these decisions, whether it's enrolling into Part A and B, or sometimes doing nothing, which one makes the most sense for your situation. So this part is really going to resonate with people who are aging into Medicare, not so much people who are already on Medicare, because you already made this decision. So when you approach age 65, you really have one of three choices. One is to do absolutely nothing. Another is to take Part A only. And another would be to enroll into Part A and B. And so which door you go through really depends on your specific situation. One of the most confusing parts of this has to do with this penalty. So if you've turned 65, or that's kind of in the next couple of months for you, you probably are going to hear a lot about from friends and from media getting into this so you don't get penalized. And so the story is that if you have COBRA, Obamacare, you're uninsured, or retiree health care, as you approach age 65, you need to move fully into Medicare. Those types of health insurances are not considered credible coverage to delay taking Part A and Part B. But if you have active group insurance through you or your spouse's full-time employment, and that employer has more than 20 full-time employees, then you can delay all parts of Medicare without penalty. And so that's where the confusion lies, is that we now see, half of the people that we talk to at 65, their plan is to continue to work, or they have a younger spouse who carries the health insurance for yourself plus your kids. And so in that situation, you would not be required to take Medicare. So very commonly, our advice to clients is to do nothing, and understand that that contradicts this marketing message or what your friends are telling you about, oh, you have to do something. You at least have to get your foot in the door or tell the government. And that's not the case. So people who are on large employer plans with HSAs tend to do door number one. And we'll talk more about HSAs and Medicare because those two overlap quite a bit. And so if you have an HSA and your employer is over 20 full-time employees, technically you don't have to do anything. You could continue to stay on that group plan, use that as your primary insurance, and then delay all parts of Medicare until you no longer have group insurance, which usually coincides with when you retire or transition into part-time or take a severance or whatever that may be. So option one, do nothing. Option two would be to enroll in the free part of Medicare, which is called Part A only. So this makes the most sense for people who are not on HSA style plans through work. Think of PPO plans where you have a copay at the doctor or a very low deductible. So if you're on an employer plan with more than 20 lives, you can take the free part of Medicare, which is Part A only. You would still get a Medicare card, but it just wouldn't have this Part B line. We would have a Part A only card, and that becomes secondary to Medicare. The main reason we would recommend taking Part A only, two things. One is that it makes your transition into retirement a little bit easier because you're already in the system. And then Part A will pay second to your group sponsored plan. So you could have a situation where your employer plan has a large deductible for a hospital stay. And because you took Medicare Part A, Medicare might cover some or all or a part of that large employer deductible for a hospital stay only. It's not going to cover anything for doctor visits and prescriptions and MRIs. And so the main reason we would recommend taking Part A only is to kind of get your foot in the door and get ready or make that transition into full retirement when you take Part B a little bit easier. The biggest negative of taking Part A only is that if you transition to an HSA plan later in life, let's say your group plan doesn't offer an HSA today, but it will next year, or maybe you and a spouse are both working and you're thinking of retiring and then rolling into the younger spouse's HSA style plan. If you've elected Part A already, once it goes into effect, it is very hard to unravel it or impossible. And so getting this right from the get-go is very crucial to avoid a lot of frustration and to not inadvertently limit HSA contributions and the tax savings or the employer match, that free money they may give you. So that is a very common point of confusion with respect to getting into the system. And then the last option would be to move all the way into Medicare and take Medicare Part A and Part B and drop that group plan. So this makes the most sense for self-employed people, people who are on small business plans with less than 20 lives. So that 20 life number is important, because if you have a group plan that's over 20, then Medicare is secondary and you can stay on that group plan. If your employer is less than 20, then Medicare becomes primary. As we'll talk about, your Medicare premium is means tested. So sometimes lower income workers under about 100,000 if you're single, 200,000 if you're married, they can find that Medicare becomes a better insurance option than their employer plan. So nothing requires you to stay on your group insurance if Medicare is a better mousetrap. So that has been a very common opportunity that I've seen, is somebody might think, oh, I'm on my group plan by myself. I don't pay anything for it, or, I haven't really looked at this in a while, and here comes Medicare. We're seeing more and more people, and again, this is all very specific to someone's situation, but an opportunity would be to continue to work full-time, continue to delay Social Security. That decision has nothing to do with Medicare. And maybe Medicare becomes a better option. And so you would drop off of that group insurance with your high deductible or your high premium and move into a Medicare plan, a supplement, an Advantage plan, because the coverage is a lot better and the incremental increase in price, depending on what your group plan is, may not be very much. Remember, we talked about Medicare next year is about $175 a month. So people who are paying more than about $150 a month out of their paycheck, a lot of times end up finding that moving to Medicare benefits them, and it doesn't require you to retire. So this is one of the most common pause spots is, everybody entering into the Medicare program, their situation is unique. And so the goal is to get this right the first time. And to reiterate, there's no penalty as long as you have active employer-sponsored insurance through you or your spouse's full-time employment. If your employer plan is HSA eligible and you are funding the HSA, you can continue to fund the HSA past age 65. But we need to pick door number one and not do anything, because if we take Medicare Part A, Medicare Part A negates the opportunity to fund the HSA. That's why if you have an HSA, door number one makes a lot of sense. If you don't have an HSA and you don't think that's going to be something available to you, then option number two makes a lot of sense. And so people can delay Part A until they retire or until they start drawing Social Security benefits. And so a common situation we would see is for somebody who's going to continue to work past age 65 to say 70. They can continue to fund that HSA at 65, 66, 67, etc. But as they approach retirement, we need to be mindful that Part A becomes effective 6 months in arrears. And so if you fully funded that HSA in January and you retire at the end of the year, your Part A effective date is going to be in the middle of that calendar year. And so we need to be aware of that. And the common advice is to shut off your HSA funding 6 months before you decide to retire. And so HSAs are awesome. They're great tools. I know Brand endorses them. I endorse them. I have an HSA for my family, but they get a little bit cumbersome as we move to Medicare. And so one of the things you may end up doing is overfunding that HSA. So you may put in, the maximum amount this year is about $5,000 per person. So if I accidentally put my 5,000 in this year, and then I found that I've overfunded it, I need to contact the custodian to remove those excess funds. And sometimes that can get even messier when you have a younger spouse or children where you're setting up a family account. And so sometimes a good kind of rule of thumb or piece of advice would be to set up 2 individual HSAs for simplicity. And then HSA funds can be used to pay for your Medicare premium. So that $175 base Medicare fee is an HSA eligible expense. So once we decide which door makes the most sense for you, if it's door 2 or 3, then we talk about how you sign up. And so really there's 2 ways to enroll into Medicare. One is an automatic enrollment. So if you've activated your monthly Social Security benefit, whether it's your own benefit, a spousal benefit, a survivor benefit, it doesn't matter, then the government will automatically enroll you into Medicare Part A and Part B without you even asking. So they'll put you right into door number 3, and then you will get your red, white, and blue Medicare card about 4 months before your 65th birthday. And that needs to be on your radar because that Medicare card looks a lot like all of these advertisements you receive. If you're not drawing Social Security and we determine door 2, A only, or door 3, A and B is most appropriate, then you need to enroll by creating an account or logging into your ssa.gov portal. And so Social Security's job with respect to Medicare is to sign you up for Medicare and then to administer the payments. So if you're drawing Social Security, your Medicare fee just comes right out of your Social Security check. If you're not drawing Social Security, then you get billed that Medicare premium until you start drawing Social Security. So one of the other frustrations that we have had is if you are signing up for Medicare the first time, we hear about this 3 month before your 65th birthday window, right? If somebody is turning 65 in January of 1959, their window to kind of get into the system opens up in October. And there's a little wiggle room on that. But typically, the very first thing that they need to do is they need to log into this website. And a lot of people have never created an account on ssa.gov, or maybe you did a number of years ago, but you've been locked out. You have identity theft, you have a credit freeze. Getting access to ssa.gov has nothing to do with Medicare Social Security. I have an ssa.gov account. James can get an ssa.gov account. Anybody can. And so a piece of advice would be make sure, especially if you're approaching Medicare, that you can log into this site, because a very common roadblock is that we meet with you in October to get you set up for January, but we find that you've been locked out of that account, and that takes, on a low end, 5 minutes. But sometimes if the government has to mail you a PIN to your house, that can take a month, where we're just kind of sitting idly waiting for the government to send that information out so we can get into the website and get you signed up. And so that would be a very strong piece of advice here, is to make sure you can at least log into that account. And if you hit some of these speed bumps, when you're 63 or 64, or maybe you're turning 65, but you're going to keep working, get that out of the way now so it's not on your plate when you have more of a time crunch. The Social Security office is still really short-staffed. It never kind of came back from COVID. And so we're seeing a lot of just, what shouldn't take a long time ends up just really starting off on the wrong foot, especially if you would have one of these non-traditional ways of getting in, like working past age 65 is a big one, or if you've ever had any type of previous identity theft, put that on your agenda to get into the program. And so once we sign up for Medicare, the price that you pay is based off of your income from 2 years prior. And so we just got the new IRMA, income related monthly adjusted amount chart in rates for next year. And so the way that we read this is if you're a single tax filer or a joint tax filer, you find which column applies to you, and then the government will look back at your income. So when we talk about which door makes the most sense for you, especially when we're talking about door number 3 and we're comparing that to an employer plan, we need to make sure that we take into account this IRMA assessment. So an example would be if you are married filing jointly and your household income from 2022 was $300,000, the government will charge you the standard fee, $174.70, but then they'll place you in the second bracket and raise your Medicare fee by about $170 a month to $350 roughly. And then when you purchase a Medicare drug plan, which most people do, they add an additional $33. So if somebody's paying $200 a month for a group plan, all of a sudden Medicare doesn't look so attractive because they means test it. If that same person is making $200,000, then they fall into the first bracket where there is no IRMA assessment. And so your income from 2 years prior determines how much money you pay for Medicare. And this is applied by the government. It doesn't matter if you have a supplement or an advantage plan. Medicare is Medicare. And so this 2-year redetermination follows you for the rest of your life. So if we fast forward to 70, 73, now you're taking full Social Security and RMDs, you may find that you kind of move around brackets as your income changes. And so IRMA is something that can be frustrating because of the way that it's applied. It can feel, kind of unfair sometimes, but it kind of is what it is. And there's also an appeal process. So if you've had a life event within the last 2 years, like work stoppage, or you've reduced your hours, then you can ask for reconsideration. You could have the government use a more recent year. So example, income $300,000 in 2022, but then you retired at the end of this year and we're getting you into Medicare 1/1/24. The look back's going to look at 22, so they're going to put you in this higher bracket, and that's for you and your spouse. So it doesn't matter who had the income or where it came from. If you're married filing jointly, you're both being assessed this equally. But if your income this year or next year in 2024 is going to be much less because you're no longer working, then you can file an appeal to have the government use your estimated income in 2024, which would totally remove that extra fee if you were under the 206 cutoff. If you don't ask for that reconsideration, then that extra fee would fall off in 2026 when the look back looks at 2024. So eventually it will right the ship. But for those 2 years, you've paid more Medicare fees than you really should have. And there's not a lot of recourse in getting that money back after the fact. And so this IRMA assessment can be tricky because the government is asking you to forecast a number that you may or may not know. And we subscribe to the accurate but aggressive approach. And if you don't ask, they won't give you the discount or the adjustment. And so when in doubt, I would recommend that you appeal. If you find that your income is going to be higher than what you thought, you will owe those back premiums back. And kind of the rule of thumb is that you should contact the Social Security office as soon as you know your income is going to exceed the estimate. But if you do nothing, then eventually the government would catch up, charge you the additional fees, and kind of bring you whole. So there's not a lot of downside in appealing and getting told no. You could come back and reappeal. And for clients who are already on Medicare and they've had this assessment already from, say, 21 to 23, and you've won the appeal, we see these redeterminations kind of be applied in a shotgun manner. There's really not a lot of consistency to where one person who won an appeal last year, that appeal counts for next year. And then, the spouse gets reassessed. And so this is something to just pay attention to. And if you've had a life event in 21, 22, or 23, this should be on your radar to appeal again. And that's something that we can help you with. There's also a form online called the SSA 44 form that is used. But ultimately what you do is you fill this form out, you get your proof of your life event, and you turn that into the Social Security office and wait until they contact you. And so that sets the stage for Medicare, right? Everybody has the red, white, and blue Medicare card, which covers on average 80% of a hospital and doctor claim. And so the confusion really lies with, what do you do to cover the 20%? So everybody listening to this webinar that's already on Medicare has made a decision to pick a path. And that is kind of the $1 million decision here that we help clients with. That is what all of this marketing noise is fighting over. And so just like group insurance, we kind of have a low, medium, high feel. I would label this path the more expensive but more comprehensive setup. And this path, Medicare Advantage, kind of the more lower end or, mid-level plan. Your premium's lower, but you give up some flexibility and freedom. And so the story is that Medicare pays the 80%. To cover the 20%, if we go down this path, what you end up doing is buying a Medicare supplement policy. That supplement is sold through private insurance companies, Blue Cross, AARP, United Healthcare, Mutual of Omaha, Cigna. There are tons of companies that sell these supplemental plans. We work with all the name brand companies, all the big names that have, competitive rates all over the country, but the benefits are standardized. And so what you end up doing is you end up buying a Plan G Medicare supplement is the most popular plan, or a Plan F or a Plan N, and the benefits have to be standardized. So the nice thing about having Medicare in a supplement, and why I would label that the gold option, is you're free to see any doctor in the country that takes Medicare, which right now is about 98% of all doctors. And so if you travel a lot, or you have a lot of doctors that you need to have access to, or you put a big emphasis on flexibility and openness, those are all reasons why somebody would go down this path. Because there is not an in versus out of network designation with Medicare in a supplement. So even though you're buying that Medicare supplement from the state that you live in, it's portable because Medicare is the decision maker. If you called Mayo Clinic with Medicare and a supplement, you would say, hey, I'm on original Medicare. Come on in. It doesn't matter what supplement you buy. If Medicare pays, the supplement pays, no questions asked. And with a Plan G, you have one out-of-pocket expense to pay one time per year, and that's called your Part B deductible. So that deductible is a number that changes every year. In 2023, it was $226. In 2024, it's $240. So on a Plan G supplement, the only out-of-pocket expense you have in a calendar year is your Part B deductible. Once you meet that deductible, then you have 100% coverage for the rest of the year. So if you've ever heard somebody kind of hype up their plan saying, man, I had this happen to me, or mom and dad got really sick, and I don't really know what happened. I just know they went wherever they wanted to go and it was all paid for. They're kind of telling you that they went down this side. And for the longest time, Plan F was the most popular and most comprehensive plan. So some of the older clients who are already, been in Medicare for a while, back when you made this decision 5, 7, 10 years ago, Plan F was kind of the gold standard. That's what everybody asked for, what we sold primarily. And the only difference between F and G is this Part B deductible. So on an F policy, you don't even pay that deductible. You have 100% coverage right out of the gate from day one. But what we're seeing is that the rate somebody pays for a Plan F is starting to get really expensive. because the younger, healthier people are all aging into the system and they can't buy Plan F. So this F versus G comparison really kind of turns into a math problem. If your Plan F rate is $300 a month and your Plan G rate is $200 a month, you could save $1,200 a year in premium, and you only give back that Part B deductible. You save about $1,000 a year. Everything else is the exact same. The access to care, how long you can stay in a hospital, how many sessions of physical therapy, all that's the same. And the buzzwords here is that there's no networks, there's no pre-authorizations. So we don't have these hoops that you may associate with group insurance. Oh, I wanted to get an MRI, but my insurance didn't pre-authorize it. That really doesn't happen over here. So if you have some health issues, you can really appreciate that comprehensiveness of kind of going where you want, not having any hurdles. And the rules on this say you get one chance to buy your Medicare supplement without answering health questions the first time you activate Part B. So if you pick door number 1 or door number 2, doing nothing, taking A only, and we delay your Part B effective date till 68 or 70 to coordinate with losing your group coverage, that is when that window, again, that common phrase of, oh, if you don't do this right the first time, you might be penalized or you might have pre-existing conditions come into play. That is not true if you do this properly. And so if we delay Part B, or you age into Medicare at 65 and you drop Obamacare or group insurance and take Medicare, and you buy a Medicare supplement the first time you enter Medicare, that's your one-time shot to buy the supplement without answering health questions. So on this side, you buy your supplement and then you add what's called a standalone drug plan. And that drug plan can be with the same insurance company or it could be with the separate one. But that's how you kind of complete the package doing the job properly. And for that setup, you have what I would label the top of line coverage. You go anywhere you want. There's no networks. You have very little out of pocket. You have no managed care scrutiny. And then you add a drug plan between $5 a month and about $100 a month based off of your medication usage. Dental and vision is another common question. When clients are on supplements, a lot of times they end up not buying dental and vision because of the cost associated with it and the limited amount of coverage that dental and vision tend to give you. So that's another question that we'll get a lot is, what do I do about dental and vision if I have a supplement? We can sell you an individual dental plan. It's usually about $50 a month. If you have access to employer coverage or COBRA, a lot of times that makes the most sense is to move fully to Medicare because the COBRA rate is $1,000 a month for medical. But if the dental is $35 or $40, most group plans will let you kind of a la carte pick. Or if we're comparing this to a group plan and you're going to work full time, you might move to Medicare, but keep that heavily subsidized group dental and vision until you no longer are working. And then we just kind of figure it out from there. So if you're already on Medicare and you have a supplement, this end of the year window is the time where you can look at either switching paths and moving into Medicare Advantage, or we could look at switching from one Medicare supplement to another, or changing your drug plan. And so in the state of Missouri, we have a window called the anniversary rule, where you can switch from a Plan F to a Plan F or a G to a G without answering any health questions based off of the original effective date of your policy. So a very common misconception that people have is they think the only time that they can change their Medicare supplement is at the end of the year, and that's not correct. If you have a Medicare supplement and you want to rate shop, because the G policy is the same anywhere across the board, you can do that whenever you want. The catch, though, is that you have to answer health questions. So if you have some pre-existings, you may find that you're uninsurable. However, if you live in Missouri, your anniversary let's say you bought your plan January 1st because you retired, your window to switch is January. If you bought it on your birthday month because you aged into Medicare, it's your birthday month. Other states have different versions of that rules. These states have a birthday rule. So regardless of when you bought your supplement, you could switch on your birthday month without answering any health questions. Or you could look at changing to the other path, which is called Medicare Advantage. And so where a lot of the confusion comes in is people wrongly associate or label their Medicare Advantage plan as a Medicare supplement. And so companies like United, Aetna, they sell multiple versions on both sides of the equation. So you could have 10 people all on United Healthcare, and they have slightly different versions of an F or a G on the supplemental side, or maybe they're on a Medicare Advantage plan. And so the way that Medicare Advantage solves for this 20% in prescription issue is you still have to fully enroll into Medicare. So to buy a Medicare Advantage plan, you have to have Medicare A and B. You have to live in the service area, but Medicare Advantage is subsidized by the government. So a lot of you listening have heard this story over and over again, where we talk about plans that have $0 premiums. Well, what's the catch? How does it work? And the story is that you still have to pay your Part B premium. And if you have that IRMA assessment, you still have to pay the higher amount. So really what we're talking about is either not buying your supplement, which for most people at 65 is going to be somewhere around about $150 a month, and not buying a drug plan. For 2024, we've got a really popular drug plan that actually doesn't even have a premium in most states. And so you're really kind of talking about saving that $150, which does go up over time, but saving that premium and redirecting it over to a Medicare Advantage plan. And so Medicare Advantage is also known as Part C of Medicare because they say it combines your hospital, your medical, your prescriptions, your dental and vision, or sometimes I'll use the word replace. So a Medicare Advantage plan replaces your Medicare. You still have Medicare A and B, you still have to pay, still keep the card, but you agree to get all of your care through that private insurance company. And the trade-off is that the government pays the insurance company and the insurance company becomes primary. So now we have an insurance carrier who is kind of at the table with you, dictating where you can go. So a trade-off is that a Medicare Advantage plan has a network. And that network, depending on where you live, can be very strong. Like I would label Metro St. Louis a very strong Medicare Advantage market. The plans have all of the major hospitals in network. A lot of your friends probably have them. We get out to Colorado or more rural parts of Missouri, and these Advantage plans look a lot less attractive. They might only have one of the healthcare systems, and the copays are really high. But the trade-off is that the Advantage plan takes this money from Medicare, and they administer your Medicare benefits. And so most plans don't charge a premium because you pay as you go. And so this feels a lot like group insurance from, say, 20 or 30 years ago. Most of the Advantage plans that we sell have no deductibles, $0 copays for primary care, $25 copays for specialists, and the max out of pocket, worst case scenario, is going to cap at about $3,000 on an HMO plan and maybe about $4,000 or $5,000 on a PPO. Again, it's very specific to where you live, but this is the other side of Medicare. And what we are seeing, and it's been this way for a few years, is that the market is kind of shifting to Medicare Advantage. You know, clients are looking at this saying, I'm paying a premium, my rates are going up on my Medicare supplement, maybe I've stayed healthy, my friends who made this decision 6 months ago or 10 years ago, they're going with Medicare Advantage. They're having good experiences with it. And so I will definitely acknowledge that the market is moving to Medicare Advantage, But the trade-off is that you're kind of in that program for better or for worse, because if you don't like it later on in life, which usually kind of coincides with having health issues or, having a lot of out of pocket, you may find that you miss the opportunity to go buy the supplement. Because to get out of a Medicare Advantage plan and kind of go back to the gold option, you have to go through underwriting, right? We talked a minute ago about that open, and that first time you get into it, that's your one-time shot to buy the supplement, no questions asked. And so as long as you're aware of that, Medicare Advantage can be a really good option. We sell all the different Advantage plans. They all have slight nuances with networks and preferred pharmacies. And then they are really beefing up these extra benefits for 2024. In Metro St. Louis, we have a couple of plans that have up to $7,000 of dental benefit. There's some plans that will pay $1,000 for personal training, golf memberships, bowling balls, like just some pretty crazy stuff. The government is really subsidizing these plans heavily, and these plans have to give that money back to you in the form of all these bells and whistles. Over-the-counter catalog credits, free gym memberships, eyeglasses, dental. The dental benefit by far is the most asked for and utilized extra benefit. And that can change negatively in a couple of years. Medicare Advantage is kind of every year it renews, and the deductibles can change, and the networks and the benefits. And so a caution would be if we kind of chase this shiny object of, wow, it has great dental and I have an implant I really need to get covered. That's fine, but that dental benefit may not be there in the same capacity in 2 or 3 or 4 years. We just don't know. And so I would never use those extra benefits as the main motivation to switch. Most people who are switching are doing so because they're feeling overinsured, especially as these Medicare supplement rates continue to increase. Or now they've been in Medicare for a couple of years. They started on the high side, and they're kind of looking at this, at 68, 69, year 3, 4, 5, whatever it is, with a little more attention. And they're kind of really questioning, like, hey, I did have a surgery and that supplement did pay everything, but, Medicare did the lion's share because it pays the 80%. I think I'm ready to try a Medicare Advantage plan. And so that's where this end of the year window comes into play. So you can switch from a supplement to Advantage, no questions asked. Since the government subsidizes these plans, they have to take you. And so this window, the annual enrollment period, is the time where we can kind of change paths or change your drug coverage. Your Medicare supplement plan, again, is not subject to the annual enrollment period, so that can be done at any time during the year. Every year we'll get a bunch of emails from clients who think, I'm happy with what I have, Carl, sign me up again. And I kind of kid like, okay, done. But the truth is that plans auto renew every year. So if you're satisfied with your coverage and you don't want to make any changes, maybe you're in the middle of a health event and you don't want to rock the boat, you don't need to do anything. As long as your plan communicates with you, because again, Medicare Advantage plans can change. And so if we're happy with the way our plan is this year and we don't look at the changes for next year, you may have a rude awakening when it comes to, your preferred pharmacy was in network this year, but isn't next year. We want to have some attention on it. But if you're happy with your plan, you don't need to do anything, and everything re-ups the following year. We've worked really hard at staying in contact with clients. So we do send out a review form at the end of the year. This year, we sent it out a little earlier. It was sent out in late August, just to give our staff enough time to kind of prep these. We go through a couple thousand reviews every year. So the end of the year is very stressful for everybody in this market. The phone lines are really, bogged down. There's long wait times. The internet and websites that we use really run slow because there's a lot of volume. But the goal would be to just make sure that your drug coverage is adequate for the following year, and that your Medicare Advantage plan is adequate for the following year. And so the way that we do that is there's a tool called the Medicare Plan Finder, and it's on Medicare.gov. Anybody can use it, or if you're a client of ours, we would go in and kind of research what plan you're on, what medicine you've changed, added, dropped, whatever it might be. And this software lets us kind of look at which plan for the upcoming year is the most cost-effective solution. And if there's enough savings, then we'll recommend changing this part, which can be done without answering any health questions. So the goal on an initial consult is to get this right the first time, get the path right the first time. If you are struggling to make a decision, again, a lot of times people will start here because they know they get one chance to do that. And you can always move to Medicare Advantage. And so if that's kind of the decision, then we would pay attention to the drug coverage. Start on, the plan that makes the most sense for you a year or two ago. And then as you add medicine or, a plan goes up in price or down in price, then we can make adjustments during this end of the year window. Or if you decide you want to switch to Advantage, we would look at your dentist and your doctors and, HMO versus PPO and help you find which version of Medicare Advantage makes the most sense. The drug coverage on Medicare by far is the most frustrating part of this. And anybody listening that is taking medications and knows about the donut hole will absolutely agree with this. The drug coverage tends to change every year, whether you want it to or not. And so one of the things that is new for next year is we have some of the substance of the Inflation Reduction Act, which was that last COVID stimulus relief bill a year or so ago, is now starting to show up on the Medicare drug program. And so the Inflation Reduction Act did a couple of things. One is it limited insulin to a $35 copay. Two is that next year it's getting rid of what's called the catastrophic stage. And then in 2025, it's implementing a max out of pocket of $2,000 per person per year. And then it's also limiting the rate adjustments that these Medicare Part D plans can increase. And this is happening in 2025. And so one of the things that is really making this market change for 2024 is that companies are trying to get out in front of this upgraded coverage coming next year, in the fact that they can't raise rates more or as high as what they have been historically. And so clients who are on original Medicare with a Medicare supplement and a standalone drug plan have really noticed this part change quite a bit. We've seen some of the more popular plans go from 20 to 50. We've seen some go from 50 to 100. And we actually saw one next year is going from $11 a month down to $0 a month. So if you've set it and forget it over the last 5 or 10 years with your drug coverage, we have a lot of momentum and movement happening in the standalone drug market because of this Inflation Reduction Act. And, if we really kind of lay all the cards on the table, these insurance companies make a lot more money per person when you're on a Medicare Advantage plan. Because over here, all they're doing is collecting your premium, and then they're covering 20% of the claim. And if you get really sick, they don't have any cost containment that they can provide. They have to cover the 20%. On these Advantage plans, the government pays them a lot of money, between $15,000 and $20,000 sometimes per person per year. And so one of the ways we've seen insurance companies kind of drive the traffic to Medicare Advantage is by really watering down this prescription drug benefit, adding deductibles, dropping popular prescriptions, raising the premium significantly, and then coming back and saying, hey, United Healthcare drug plan going up in price. Don't forget to look at our Medicare Advantage plan, which also has some dental and vision and hearing aid benefits to try to get you to switch over to Medicare Advantage. So this year, we're seeing being 2024, we're seeing some big changes in the drug market, specifically with respect to rate and list of medications. And so the donut hole is one of those frustrating things that really every version of Medicare has. So there's really not a way to buy a drug plan that doesn't have a donut hole. And the donut hole only comes into play if you exceed this initial coverage phase. It's right at about $5,000 for next year. So if anybody listening is taking meds like Xarelto, Eliquis, Ozempic, that new weight loss medication or diabetic drug that's been shown to have success with weight loss, those drugs retail for anywhere between about $500 and $1,000 a month. So when you walk into the pharmacy and you pay your $50 copay, we have this math problem of I've paid $50, my insurance company has paid $950. It's the sum of those two numbers, that $1,000 is what is counting towards getting you in or coming out of your $5,000 bucket. And so if we just run the numbers, if you're on $1,000 a month medication next year, in 5 months, you're going to exhaust your initial bucket and fall into the donut hole or the gap. And when you do that, your coverage changes. Instead of paying that flat copay, $25, $50, $80, $0, whatever it might be, you now have to pay 25% of the negotiated price of the medicine. And so every year, clients on Ozempic will call us in May because it takes 5 months to get into the donut hole. And they'll say, Carl, my Ozempic went from a $50 copay to $250. Help. Or if you're on Eliquis, that drug it's an AFib medication, is about $500. So sometime in October, September, clients will call us and say, Carl, my Eliquis went from a $25 or a $35 copay to now I have to pay $120, $140, 25% of that $500 or $600 sticker price. And so the donut hole is really confusing. It can never be an issue if you're on a bunch of generic medications and never exhaust your $5,000 bucket, or it could be something that you are very aware of because of your medications. And so the big change for next year is that the catastrophic coverage phase, which we would label like the exit point of the donut hole, you used to have to pay 5% of your medication costs, and now that is being capped at 0. I would estimate probably 90 to 95% of people all across the country on Medicare never hit this. But the 5 or 10% of people that do, this is a huge savings. I'm thinking of one client I looked at. Fortunately, he was diagnosed with ALS, and he was on about $300,000 a year worth of medicine. And when he hit this catastrophic phase this year, he still spent about $900 a month out of pocket. Next year, he won't spend anything. And so that's a huge savings, but that additional expense, the insurance companies are having to pick up because of this Inflation Reduction Act. And then in 2025, that's going to get even more impactful, where people on Ozempic and Eliquis or a combination of those scripts, once they spend $2,000, they no longer have to pay for the rest of the year. And so we're really interested to see just kind of the next year or two with prescription drugs, what that looks like. Do companies raise rates even further? Do they add really high deductibles? Does the government come in and subsidize more of this? So stay tuned for next year. We'll kind of see what that looks like. And so the drug benefit when you're on Medicare continues to be the most frustrating part of this. And in response to that frustration, we've seen a lot of change with people, pharmacy shopping. I buy my generic medicines through my insurance, but then I use GoodRx or the Mark Cuban Pharmacy, CostPlusDrugs.com, Amazon Pharmacy, nothing requires you, regardless of what plan you have, to buy all of your medicine through that plan. So it just becomes kind of a, bang for your buck type thing. If you want to ship one drug from Amazon because it was $5 there versus 80 through your drug plan, go for it. If you want to buy another one through Cost Plus Drugs or through Canadian pharmacies, it's just a matter of staying organized and knowing, where you're buying your meds through. But that is a very common outcome, especially for hormone replacement medications, compounded drugs, creams and ointments for things like eczema and rosacea. Those classes of medications tend to be commonly purchased through one of these coupons or discount pharmacies. Most of the plans that people buy nowadays have this silver sneakers benefit. And so I wanted to share something that actually a client brought this up to my attention a while ago. But if you are on Medicare and you have silver sneakers and you use that, silver sneakers is one of those extra perks that pretty much every plan has at this point. You can go to different gyms, Planet Fitness, Lifetime Gym on certain plans, the YMCA's, Club Fitness, there's a whole list of them. But if you sign up for this tuition rewards program, Silver Sneakers will actually pay you through scholarship money for your grandkids to go work out. And so it's kind of unique. The client that turned me on to this, she has like $15,000 of money for her grandkids banked for doing something she was going to do anyways. And there are some limitations on, what school you can use, et cetera. But it's this tuitions reward program through Silver Sneakers is something to maybe check out if that is something you are interested in or doing already. And then I would just kind of leave it at this, is like the market is continuing to move towards Medicare Advantage. So if this is something you've been kind of, playing with left and right and, looking for kind of that reason to take a jump, maybe 2024 is a year you give it a shot. But we just need to make sure that you fully understand the pros and cons of getting into Medicare Advantage. Don't chase the shiny object of a free Fitbit or, just because your friends are on it. Let's make sure that it's the right plan for you. And if it is, we'll happily help you make a move. So appreciate everybody taking some time to listen. Happy to answer any questions. Here's my contact information. We are licensed in all 50 states at this point. We sell all of the plans out there. They all compensate us about the same. So our goal is to try to make sure that you're educated as much as you feel like you need to be, that you're on the right plan for your specific situation, whether that's the same plan as your spouse or your neighbor or your friends. We just need to make sure you're on the right plan for you.
Yeah, and I'll just reiterate our appreciation for you taking the time to be on the webinar. I think you would all agree by the way that Carl presented a complex amount of information that he's an expert in the field. It's why we send all of our recommendations to him. We also love that he's an independent insurance broker, that he's a generational family-owned business. But I want to reinforce something that he said a few times. The complexity of this situation, it really will be particular to your situation. And so he wants to talk to you. Please reach out to him. Reach out and ask a question that's particular to your situation so he can really guide you. I know that he wants to, we trust, him, and we know that he'll want to find the best plan for your best interest.
And I would say email, especially during open enrollment, I'm working, I feel like 24/7 right now. Email is the best way to get a hold of me, because I'll probably email you. I watch a lot of playoff baseball when it comes to open enrollment, because I'm just, got the kids in bed and kind of getting caught up on the day. So I usually try to get back to people within 24 to 48 hours through email. It just might come through at a weird time. So.
Well, thanks, everyone. We'll let you get back to your day, but any questions that you have, again, you can reach out to us, but also email to Carl, so he'll have something to do in the middle of the night.
Besides sleeping. All right. Thanks, James.
Yep. Thank you, everyone.